Karen James, the Chief Executive, and I'd like to introduce you this month to Naveed Riyaz, who's our Clinical Director for the Ashton Neighbourhood. He also takes a clinical lead with respect to managing the urgent care system. So what I thought would be interesting this month is to learn a little bit about Naveed's role in terms of the neighbourhood, and a little bit about what Naveed does with respect to providing leadership for our urgent care system. So, morning.
Hi.
In terms of your clinical director's role from a neighbourhood perspective, I just want to learn a little bit more about your responsibilities, what your role is about, and a little bit about what you've achieved over the last 2 to 3 years with respect to delivering a neighbourhood approach.
So I think the neighbourhood role is quite varied and quite broad. It started with us working with our Ashton practices, so I work with the 8 Ashton practices and just oversee the work that's going on a neighbourhood basis. We try to put in new plans and processes to improve patient care. So for example, we've tried a Nesta COPD challenge not so long ago, and we've also had a community pre-diabetes event as well. There's something also about working with other stakeholders from across the health and social care economy to make sure that we can maximise our potential as a neighbourhood and improve patient care to the nth degree.
Yeah. And in terms of the neighbourhood development, what do you think the real benefits have been, both from your perspective and if I was to look from a patient perspective as well?
So I think from a professional perspective, it's been really great to get to know the people who are in the neighbourhood. I don't think there are lots of new people as such, but there are lots of people who are already working in silos across the neighbourhood, and it's been great to be able to get to know our community services, our third sector services, and also trust colleagues as well. I think from a patient perspective that will be reflected in the improvement in care, because we now have a much more joined up approach. There's less of a bureaucracy in terms of having to formalise processes and referrals. Actually, we can pick up the phone and talk to each other, and often we have a much more multidisciplinary approach where we can sit in the same room, talk about the patient and decide what the best outcomes might be for that person and how best we might be able to achieve those outcomes.
And what's from your perspective, what's been the change in the interface with the hospital?
So it's been a really broad opportunity to get involved with the hospital and also to have hospital colleagues working with us. I think for the first time we've had a chance to present our vision and our experience in primary care and our experience in the community, and work with trust colleagues to see how we can best care for patients in the community. I think probably the best example of that probably would be our digital health platform, which, although it's based at the Trust, provides great care to our nursing and residential home residents and helps to reduce the need for them to attend hospital where possible.
And we've been introducing some new models of care, haven't we, within the neighbourhoods. And I think last month we, in terms of focus on, we looked at social prescribing.
Absolutely.
The new models of care that we have introduced, what do you think some of the benefits have been in terms of primary care and becoming a GP?
I think certainly from a patient perspective, it's just introducing new ways of looking after people. We traditionally have done what we've always done and expected the results to be different. This time around we've had a chance to do things differently and progress and take forward steps. We've had a chance to think outside the box. And look at what patients really need rather than looking at what we can provide. So looking at those needs and then working our provision around that has been really advantageous for patients. It's really opened up the door to involve third sector and community services so that patients don't always need to see a doctor or a nurse for their health and social care problems. They can access a number of different platforms and ports of call to help and support them.
So not only a GP, clinical director for the neighbourhood, you're also providing leadership for our urgent care system. Can you tell us a little bit about, again, what your role is within that?
Yeah, absolutely. So the big thing that I think probably I take control of is the A&E Delivery Board. I chair that. And that involves working with a number of different stakeholders, so colleagues from North West Ambulance Service, Health Innovation Manchester, Greater Manchester's Health and Social Care Partnership, as well as trust colleagues, both from Tameside and Glossop's Integrated Care Foundation Trust and also Pennine Care, who provide our mental health services, and some of our amazing commissioners, and also outside colleagues as well. For me, I think I like to look at urgent care and look outside the box. So traditionally we've always the urgent care is A&E, but it's so much more than that. Urgent care starts from the front door of the patient's house, and it's how we can care for people better. So that involves bringing in our community response services and reducing falls, helping to get people up off the floor when they have fallen rather than having them come to A&E. Implementing strategies like digital health so that we can put care into the place where people are being cared for, and also making sure that when people are arriving at hospital that we can care for them better. So implementing an effective primary care screening model, putting a GP into A&E so that patients can be seen by a GP as well as by the traditional A&E team, and how we can develop and progress that, improve our flow and improve our performance.
And it's been a very effective partnership working, hasn't it? Because actually we are one of the best performing systems within GM.
That's right.
And I think that's come about because we are working collaboratively, and we've developed new models of care that have been very responsive to try and manage patients within the community rather than having to come in hospital.
Absolutely.
So thank you very much, because you've provided fantastic leadership with respect to urgent care, and I know that we really enjoy working with you in your clinical director's role for the neighbourhood, and long may that continue.
Thank you very much.
Thank you very much for your time.